Do you feel extremely tired, have difficulty concentrating, blurry vision, tremors, tingling, or mental confusion? Then be careful. If you or someone you know is experiencing these signs, do not ignore them, as these are symptoms of multiple sclerosis, a disease that affects nearly 3 million people around the world, mainly those between 20 and 40 years old, and one of the leading causes of disability in young adults. In this video, we'll go over the basics of multiple sclerosis. What is it? Who gets it? We'll discuss the symptoms, diagnosis, and treatment options. Whether you're curious about your own health or someone you care about, we're here to give you the best info we can. Multiple sclerosis, or MS, is a progressive autoimmune condition. Basically, your immune system mistakenly goes after your central nervous system, hitting the brain and spinal cord. This attack damages myelin, the protective layer around nerve fibers, which messes up the smooth transmission of signals from your brain to the rest of your body. The effects of this mistaken attack can be devastating, but the earlier therapy is initiated, the greater the chances of controlling symptoms and slowing the progression of the disease. Now that you're familiar with the condition, let's get straight to the multiple sclerosis symptoms. Stick around until the end, as one of the symptoms is so common that it can go unnoticed. Symptom number 1, extreme fatigue. Busy everyday life, stress, a lack of sleep, intense exercise, and so on. These are some typical situations that result in excessive tiredness. Usually, the feeling goes away after a full night's sleep or a few days of relaxation. But what if this fatigue doesn't go away even after rest? Then it's time to pay attention. Nearly 80% of people diagnosed with the disease experience fatigue at some point, according to the Multiple Sclerosis Association of America. When associated with MS, it can be challenging to deal with and also hard to explain to others. Although it's an invisible symptom, fatigue is very real for those living with the disease. 2. Muscle weakness. Muscle weakness, like excessive fatigue, is a critical symptom of multiple sclerosis that should not be overlooked. This illness causes sudden and unexpected loss of strength and movement. Muscle weakness in multiple sclerosis is caused by the deterioration of nerves that control muscles. This nerve system damage can cause a variety of symptoms, including decreased movement, difficulties doing physically demanding tasks, tremors, cramping, and difficulty supporting the body's weight. Furthermore, issues with breathing, chewing, speaking, or swallowing may occur, severely impacting the patient's quality of life. It is vital to point out that muscle weakness can affect individual muscles or interconnected muscle groups, increasing discomfort and difficulty in everyday life. 3. Balance and coordination issues. When it comes to body movement, another sign of this disease is having trouble keeping balance and coordinating movements. Multiple sclerosis can make it tough for the brain to send clear signals to the muscles. Remember how we compared the brain to a well-tuned orchestra at the start of the video? Keeping your balance needs a lot of different parts of the brain to work together, especially the cerebellum, which is super important for this. If MS hits the cerebellum, the brain might struggle to make up for it, leading to problems like feeling unstable when walking, having a hard time walking in a straight line, and even falling often. Plus, doing things that need precise movements, like writing or tying shoelaces, can be really tough for folks with multiple sclerosis. These symptoms not only make moving around harder, but also affect independence and overall quality of life. 4. Vision problems. It is crucial to note that multiple sclerosis may manifest in the eyes. One of the early signs might be trouble seeing clearly. A common example is optic neuritis, which affects the optic nerve responsible for sending visual information from the eye to the brain. This can cause blurred vision, spots in the field of vision, and even pain when moving the eyes. These vision issues are caused by inflammation and lesions on the optic nerve, which disrupt the transfer of visual information. When the optic nerve is damaged, communication between the eyes and the brain is disturbed, causing a variety of visual problems. Therefore, if you notice any changes in your vision, it is critical to seek medical assistance. Have you ever noticed spots in your field of vision while driving? Or experienced blurred vision? What steps did you take to find relief? Please share your experiences with the incredibly healthy community below. 5. Bladder and bowel control problems. Another symptom worthy of attention related to the disease is bladder and/or bowel problems. Although quite common throughout life, these conditions cannot be ignored. In multiple sclerosis, communications between the brain and the bladder or bowel can be impaired. This can cause a wide range of symptoms, including a lack of sensation to urinate or defecate, as well as severe urgency or frequency. Nerve injury to the bladder and intestines can cause symptoms such as urine incontinence, urinary urgency, difficulty urinating or defecating, and constipation. Also, as we mentioned earlier, having trouble pooping can be due to weak or uncoordinated anal muscles, problems with the pelvic floor muscles, and issues with the anus. Liking our video so far? Before we move on to the next multiple sclerosis symptom, don't forget to hit the like button and subscribe to our channel so you never miss out on our new informative video. 6. Cognitive and speech problems. Besides physical symptoms, multiple sclerosis may affect cognitive function, such as memory, concentration, judgment, and thinking. These cognitive challenges can vary from mild to severe, and you might experience difficulty remembering things, staying focused, making decisions, or processing information quickly. Regarding speech, lesions in areas of the brain that control language can cause changes in communication. These difficulties can range from subtle to quite significant. They typically develop later in the course of the disease. A common issue is slurred speech, especially during periods of fatigue or relapse. Other problems may include weakness in the voice, prolonged pauses between words or syllables, difficulty understanding what is being said, and difficulty recalling vocabulary and grammar. 7. Heat intolerance. Last but not least, we have a peculiar symptom that may go unnoticed in the diagnosis of multiple sclerosis: heat intolerance. In fact, this is an almost universal complaint of the disease. This sensitivity is so common in MS that in the past, the hot bath test was used to diagnose the disease. In it, the person would immerse themselves in a hot tub to see if neurological symptoms appeared or worsened. Studies indicate that between 60 to 80% of diagnosed individuals may experience this excessive heat sensitivity. This sensitivity can manifest even with a slight increase in body temperature, whether from physical exercise or warmer environments. This phenomenon can exacerbate other symptoms we mentioned earlier, such as fatigue, vision, and cognitive problems, and even the emergence of new concerning symptoms. Identifying these symptoms as early as possible can make all the difference. We understand that figuring out if your symptoms are due to multiple sclerosis can be tough, especially since some of them might be unclear or resemble those of other conditions. But the general rule is clear. If you notice any changes in your body, or if persistent symptoms arise, it is essential to consult a doctor. How can one diagnose multiple sclerosis? The diagnosis of multiple sclerosis can vary depending on the types of disease manifestations, and is mainly based on symptoms and physical examinations. When doctors suspect multiple sclerosis, they thoroughly evaluate the nervous system, neurological examination, during a physical exam. Additionally, the healthcare professional may request laboratory and imaging tests, such as magnetic resonance imaging, to confirm the presence of inflammation in the nervous system and rule out other possible causes. Treatments for multiple sclerosis. Although multiple sclerosis is a chronic and autoimmune condition without a cure, treatment has evolved significantly in recent decades. For those with relapsing forms of the disease, medications called immunomodulators are available, which modify the course of the disease, along with various other techniques and procedures indicated by the doctor. Furthermore, a comprehensive approach involving lifestyle, nutrition, physical activity, and emotional aspects is fundamental and beneficial for everyone. People with multiple sclerosis often manage to maintain an active lifestyle. Regular exercises such as stationary cycling, walks, swimming, and stretching not only reduce spasticity, but also contribute to cardiovascular, muscular, and psychological health. Physical therapy is an important ally in maintaining balance, walking ability, and mobility, as well as helping to reduce muscle spasticity and weakness. It is encouraged that people with MS walk as much as possible on their own, as this improves quality of life and helps prevent depression. Avoiding high temperatures, such as hot baths, can be helpful, as heat can exacerbate symptoms. Additionally, it is important for people who smoke to consider quitting, as smoking can further impair health. As mentioned in previous videos, it is important to emphasize the need to seek medical help if symptoms persist for weeks. This is especially important since symptoms may be related to various health conditions. We hope the information provided has been helpful and informative. If you'd like to stay updated with more life-saving information, please subscribe to our channel, hit the notification bell, and check out 2 more recommended videos. Until next time, bye!